Most people don't realize this, but your body often screams out a warning up to a week before a deadly stroke. A sudden, splitting headache, a strange droop on one side of your face, weakness in your arm or leg that lasts just a few seconds. These aren't random. They're red alerts from your brain. Ignore them, and you could be rushing straight into a life-changing stroke. In today's video, I'll expose these hidden warning signs and show you why, when it comes to your brain, every second you waste could cost you everything. Part 1. Understanding stroke and vulnerable areas. First, let's understand how strokes happen. There are two main types: ischemic stroke, caused by a blocked blood vessel, and hemorrhagic stroke, caused by a burst vessel leaking blood into the brain. Both are extremely dangerous. A major blockage or heavy bleeding can send someone into a coma within minutes. Did you know that the brainstem, located at the base of your brain just above the back of your neck, is one of the most vulnerable areas of the human body? A strong impact here can cause instant unconsciousness. That's because the brainstem controls your heart, breathing, and blood circulation, and it's not as well protected by bone as the rest of the brain. This is why serious falls, car accidents, or head injuries can be so dangerous, and why stroke symptoms can sometimes strike without warning. Part 2. Early warning signs. 1 week before stroke. Here's something most people don't know. Before a full-blown stroke strikes, your body often whispers a warning. Doctors call it a transient ischemic attack, or TIA for short. Think of it as your brain flashing a red light, saying, "Pay attention, something big is about to happen." The signs can look small, almost harmless. A drooping face that lasts a few minutes, slurred speech, or weakness in one arm or leg. Then, just like that, the symptoms vanish. Many people shrug it off, pop a painkiller, or tell themselves they were just tired. But that moment, that window, is your golden opportunity to act. Here's a key detail that could save someone's life. When it comes to facial drooping, you need to understand the difference between peripheral nerve weakness and central brain weakness. Peripheral weakness: the person can't fully close their eye, their smile looks crooked. Recovery is usually slower, but it doesn't always require immediate emergency care. Central weakness: only the lower part of the face droops, often paired with slurred speech. This is a direct sign of brain injury, and it's an emergency. So, if you or someone you love ever shows sudden drooping of the face or slurred speech, don't wait it out. Don't Google remedies. Don't try to sleep it off. Get to the hospital immediately, because in stroke care, every second lost is brain cells gone forever. Part 3. Other critical warning signs. But facial drooping isn't the only warning your body gives. Here are other red flags you need to take seriously. A sudden, severe headache. Not your usual headache, but the kind that feels like a bolt of lightning. Painkillers don't help, and if it comes with nausea or vomiting, especially in younger adults, don't ignore it. Dizziness and loss of balance. This is not the same as regular vertigo, where the room feels like it's spinning. Stroke-related dizziness is deeper. You feel like you're about to collapse. Patients may stumble, fall, or can't even stand steady with their eyes closed. Weakness on one side. If your left arm suddenly feels weak or numb, it usually means the right side of your brain is in trouble. If your right arm goes weak, it's the left side of your brain. This one-sided weakness is a classic hallmark of stroke. Speech and memory issues. Sometimes, stroke starts with small but scary moments. You can't find the right words, you forget simple names, or you feel confused about where you are or what day it is. These aren't just senior moments, they're emergencies. Think of these signs as flashing warning lights on your car dashboard. If you ignore them, the engine blows. But unlike a car, you can't replace your brain. Part 4. Early Emergency Response and Treatment. So what should you do when these symptoms strike? Remember this phrase: time is brain. Every minute of delay means millions of brain cells are dying. Here's what you should do right away. Lay the patient down with their head raised about 30 to 45 degrees. This helps keep airways open and prevents choking. Loosen any tight clothing, especially around the chest or neck. Call 911 immediately. Don't try to drive the person yourself unless there's absolutely no other option. Once at the hospital, doctors act fast. Within minutes, they'll run a CT scan to see what type of stroke it is: a blockage, ischemic stroke, or bleeding hemorrhagic stroke. MRI scans can provide detail, but they take longer, so CT is the first choice in an emergency. Here's the critical part. For ischemic strokes caused by clots, there's a golden 4-hour window where doctors can give powerful clot-busting drugs or even perform a procedure to physically remove the clot. Miss that window, and the damage may be permanent. After stabilization, doctors may prescribe antiplatelet drugs like aspirin or clopidogrel to prevent new clots, cholesterol-lowering medication such as atorvastatin or rosuvastatin, other brain circulation and supportive medicines depending on the patient's condition. But recovery doesn't end at the hospital. Early rehabilitation is just as important. Physical therapy, especially fine motor exercises for the hands, can retrain the brain. Something as simple as rolling a ball in your palm or practicing gripping objects can rewire damaged pathways and speed up recovery. The earlier you start, the greater your chances of walking, speaking, and living normally again. In fact, many patients who get help fast can make remarkable recoveries within just 2 weeks. So, if there's one thing you take from this video, let it be this: don't ignore the small signs. A sudden headache, a brief weakness, or a slurred word might feel small, but in reality, they're life's biggest alarm bells. Your quick response could mean the difference between full recovery and a lifetime of disability, or worse. Here's the truth: a stroke rarely comes out of nowhere. Your body almost always tries to warn you days, sometimes even a full week, in advance. If you, or someone you love, shows signs like a drooping mouth, slurred speech, sudden weakness in the arms or legs, a crushing headache, or dizziness with loss of balance, don't wait. Don't hope it goes away. Get to the hospital immediately. And remember this: in these moments, time isn't gold, it's your brain. The faster you act, the greater the chance of full recovery. With early treatment and the right rehab, many people are able to return to a healthy, normal life. So please, don't keep this knowledge to yourself. Share this video right now. You might save a friend, a parent, or even your own life. And one more thing: if you'd like to receive free resources, tips, and a special gift I've prepared just for you, send me an email at petarai666@gmail.com. I'll make sure you get something valuable that could make a difference for your health. Together, let's spread awareness, protect our brains, and save lives.